All right, I am super happy to have this conversation with you, and we're kind of rolling this episode of the podcast in, but I am joined with a friend of mine that we were just talking. It's been too long since we last spoke
Way
to
too
each
long.
other, and I actually we kind of got reconnected because I had a client question, and the reason I thought of him is that when we did meet in person, he blew my mind just talking about the biomechanics of dealing with pain in people. And I'm very happy to have you on with me today here, Mr. Dr. Kev. How's it going, man?
Dude, appreciate you having me on. Love being here and excited to get to rekindle this and like actually chat with you because like you said, it's been a minute. I'm good. I'm good. I'm excited to have this conversation. It's something I always enjoy talking shop about and my bread and butter. I mean, it's why I'm a doctor in the first place. So there you
Yeah.
go.
Yeah, that's awesome, man. Well, I'm gonna give you the floor really quick. Introduce yourself. What the hell do you know so much about, and why the hell are you a doctor in this?
Yeah, exactly. So like Jonah said, my name is Dr. Kev. I am a doctor of physical therapy. I originally got my bachelor's in exercise science and then decided to get my doctorate in physical therapy at Western Michigan University. And from that, basically created a whole company all around helping people get out of pain and get back to working out and living life pain free. So my expertise is really in everything injury, rehab, and pain related. That is our bread and butter and everything that we do within our company, the Rehab Coaching Collaborative. So basically here to talk all things shop around helping any of you guys who may be struggling with pain or injuries yourself out of that and hopefully feeling better and moving better and being able to live life better.
Dude, I love that so much, especially as coming from someone who was an athlete his entire life and learned to play through pain,
Yeah.
and wasn't fully aware that there was actually strategies and exercises that were meant to reduce a lot of the chronic pain I
Right.
was
Yeah.
in,
Yeah.
right? And then, there's a lot of people who didn't play sports growing up, but as we get older, we're not as active, we lose range of emotions, things are a little bit easier to get out of place and we have to deal with. So what is the most common, you know, um, pain that you tend to see on a regular person, and how do you help them really work through that process?
Yeah, I would say most common for sure is definitely low back pain. I would say, um, I'm probably gonna butcher the statistic, but like I'm pretty sure like over 97% of people have non-specific low back pain, as we call it, at some point in their lives.
Mm.
Which a lot of people who are listening to this can probably be like, oh yeah, like I remember like tweaking my back at some point or whatever. Like everyone's dealt with it at some point, and it's something that's a very common occurrence, some more debilitating than others, but I would say that's like the most common thing. I would say behind that is like shoulders and knees kind of tied together for just like acute and chronic injuries. But like the way I go about really just from a broad perspective rehabbing all pain is mostly the same regardless of like what I'm dealing with. Obviously, as we'll probably talk about, there's specific nuances when it comes to like low back and even just different things with the low back versus like shoulders versus knees, etc. But the general principles of like how we specifically handle like treating pain all remain the same, which I always teach my clients and my coaches on my team and everyone, a 4-step framework that we use to like actually get everyone out of pain, which is called the reps method, which simply stands for restore, exposure, potentiation, and sustain. So that's really like the 4 model process that we use, which basically just stands for restore, restoration. Every single person that's in pain, the first thing we have to actually do is be able to like calm that down, right? Because there is nothing that we can do from a rehab standpoint if you're in this excruciating like 9 out of 10 pain rating that like nothing can solve. So the first thing we need to do is actually like restore and calm down your pain, which we can probably dive into later. There's a whole host of things that go into that, right? Number 2 is that we actually need to start building up, someone's tolerance back to activity that's causing them pain to begin with, which then comes with the exposure and the potentiation stage of what I was talking about. We need to get someone moving back with what was causing them pain in the first place, and then getting their bodies accustomed to the activity that hurt them in the first place. And then lastly, sustain. We can do all the work in the world, but if we actually don't put the necessary principles in place to keep that pain off long term and sustained for a long period of time, then none of the work we've done before is any good. It's the same thing for probably things you've talked about, Jonah, of, people that are on a fat loss journey and, needing a plan after the diet, essentially, or like what's the diet after the diet so they don't actually yo-yo and gain that all back. It's the same thing with like rehab. We can do all the work on the front end, but if we don't have an actual sustainable pre-op process on the back end of that to set someone up for success long-term to keep them injury free, then we're not doing our job. So, and that comes with a whole host of things we'll probably talk about how do you actually stay injury free? How do you keep injury off and like pain away? There's a whole bunch of things we can probably dive into there, but that from a broad bird's eye view, like that's like the 4-step process we basically go through with like everyone,
I
regardless
love
of like,
that. Yeah, I love that. And it highlights the aspect of understanding and assessing the true pain and where it happened, why it happened, and ultimately how to rebuild and restore your ability to move within the range of motion that was pretty dangerous or caused a lot of pain.
yeah.
Remove that pain and truly understand how to continue to move with that newfound awareness so that you don't essentially hurt yourself again, right? And the whole reason I even reached out to you to begin with was because I had a client who was going through some tough lower back pain. And I feel like a lot of people, they feel any sort of pain in their posterior chain relatively close to their low back, and they immediately think, I hurt my back, I hurt my back, I hurt my back, right? And then, from my understanding, I'm a personal trainer, but I know only a little bit about corrective exercise. I know the broad sense of like, if you have pain in those general areas, it's not always the fact that it's your back. It could be found in other areas. It can be caused due to some dysfunction in other areas of your body, right? Hips are a huge one, right? So out of based off your professional opinion, again, I consider you an expert in this, how is there like a blanket exercise that most people can be doing, or does it really take true assessment that's going to help, prevent pain, especially in the major area of that many people may not consider a problem area, like their hips? Does that make sense? Did I word that right?
Yeah, that makes sense. I'll answer this from two different ways. I think in general, for a good amount of people that have been dealing with pain for, we'll say, anything past an acute phase. So I'm going to quantify that as like, if you've been dealing with some sort of pain that's lasted longer than like 6 weeks, for example, then it probably stands that it needs a true assessment, because to your point, there's a lot that can go into it. For example, with like low back, it's like first identifying, is it muscular pain, neurological pain, a mix of both? Is it extension versus flexion intolerant versus rotational intolerant, which is just a fancy way of saying, where are you feeling the pain during what movements? Is it, when we go through PT school, the number one thing we initially first learn is like, hey, when you're assessing someone, you want to assess joint above and joint below, aka if you're looking at the spine, like you pointed out, you want to look at the joint above, so like thoracic spine above your low back, and then joint below, so your hips, for example, right? And even below that with the knees even. So it takes true assessment to really identify on that front if you've been dealing with it for a decent period of time, especially if it's leaning into chronic pain, what specifically might be going on, both from a biomechanical load front, but then also just from a movement front, to see what we can fix and identify there. But then on the flip side of that, if it's not that, and it's like, hey, I just tweaked my back, or I just got this sprain or whatever, and I'm dealing with pain, not necessarily that there's like one exercise, but more so like a main principle, which is, I always like to say the adage that the antidote many times is a lesser dose of the poison. And what I mean by that is, for a lot of people that are dealing, let's say it's your low back, let's say you were lifting and you were like squatting, for example, or like doing a lunge or something, and like you tweaked your low back and now you're like in pain. You're like, what do I do? Like, the antidote is a lesser dose of poison. What that refers to is that many times, especially if it's an acute pain, you can simply, it's really just about finding your entry point back into loading, if you will. And that's when I talk about like the 4-step reps model like process. Where you start there really depends on like what you're dealing with. So if it's like a very acute thing and it's like not super serious, like it's not a very structural mechanical thing, you might start near the latter half of that, near like the potentiation phase, I call it, where it's like we can just find your entry point straight into loading, which for a lot of people might mean going back to actually the exercise that hurt them, quote unquote, in the first place, right? Antidotes, lesser dose of the poison, and identifying where in that range of motion does that pain hurt more, and where in that range of motion of the movement that do they not really experience as much pain. For example, I might be working with someone who's experiencing like low back pain during squats, and they identify that it hurts the most when they're like at the bottom near like parallel with their knees, and that's when they get the most excruciating back pain. But if they're like anywhere above that in like the top portion of the range of motion, they're good. In that case, I might just, if it's super acute, just start someone right back with like squats at like a reduced range of motion, say like a box squat or a pin squat at a high range of motion, supplement with other exercises, or maybe even an alternative like belt squats where there's less shearing stress just being placed on the back from an axial standpoint. It's always just about finding that entry point back into like loading those tissues as much as possible, especially if it's acute, because you're going to be able to bounce back that much faster. And chances are, with a lot of pain, it's mostly non-specific, meaning it's probably not tied to anything structural per se, and you probably didn't do any serious damage, which means that you can bounce back into the movement that actually hurt you in the first place, because that's going to get you back towards the latter half of that process, like I talked about, as quick as possible. The second thing I'll quickly add on to that is that the reason that's also important is that not all pain is structural. And what I mean by that is I think it's very common for people to think, I sprained and hurt something, so something's physically wrong with me, which isn't always the case, because tissue damage doesn't always equal pain. And there's this whole concept within pain called the biopsychosocial model, or BPS, which simply stands for, there's the biological, like mechanics, right? But then there's also the psychological and sociological components. And what people don't realize is that a lot of pain many times, because all pain's an output from the brain, and a lot of pain many times is just a faulty smoke alarm, if you will, that's like going off, and that's on higher sensitivity than it normally is. And the reason getting back into the activity that hurts you in the first place is so important early on, if you can, is it helps to rewire essentially circuitry from your brain, if you will, on being comfortable with what actually hurts you in the first place, because so much of pain is psychological and sociological in the first place. I give the whole adage to clients many times of, if you have like a smoke alarm in your kitchen, and maybe it's like one of those like super faulty ones that like you're cooking something on like the oven stove top or whatever, and like a hit of steam like hits the smoke alarm and starts like blaring all the time, and it's like,
That's
oh my god,
mine.
like
That's my
like,
smoke alarm right now.
yeah, that was mine in my last apartment, like same thing. And I was like, and it's like, please shut up, like there's no fire going on. Sometimes your body's own alarm system of pain, just like that smoke alarm example, is overly sensitized, and the littlest things will like set it off. It doesn't mean anything's wrong, just like with the smoke alarm example, doesn't mean there's an actual fire going off in your apartment or whatever, but it does mean that it's just a warning system for something that may or may not be true. Just like the smoke alarm example, it probably isn't actually true, and something might not be physically wrong, but it's just like overly sensitized. So getting back to the exercise that hurt you in the first place and doing that whole process helps to desensitize that alarm system, if you will, and actually get you back to where you want to be like that much quicker, right? So there's a lot that goes into it from that
Dude,
front.
I love all of that so much. It's so cool to be on the other side. Because usually I'm the one who like just unravels like all the
Yeah.
stuff, because I do a lot of the psychological side behind dieting and exercising,
Mhm.
right? It's not the fact that the person is, lazy or miserable when they're on a diet, or I'm sorry, lazy and just lack willpower. It's a lot of times the relationship that they have going on in their head when it comes
Mhm.
to food, when it comes to exercise as punishment, or there's good versus bad. That's a lot, and then they avoid these things, and then their behaviors ultimately put them in a much more tough place, right? You're coming at it through the sense of the mostly the physical, but again, still the psychological aspect of like, hey, this thing that you hurt, it's totally normal to be scared to do it again.
Yeah.
However, by desensitizing ourselves, destigmatizing that response you have in your head is actually going to be much more beneficial than just
Mhm.
simply avoiding it, depending on the certain injury, right?
Yeah.
You know,
I
if it's
mean,
Go ahead.
I remember reading somewhere to that point that like I think it was like the biggest predictor of like whether or not someone like rehabs from an injury is their level of optimistic like outlook on like their outcome like from it. And that goes for like a specific acute injury, that goes for any sort of pain. Like if you, and that's why like I always start there with like every single person, because if that foundation psychologically is not there, I could do all the other work in the world with them, but like they're just going to keep getting re-injured because that alarm system is so overly sensitized, if you will. It doesn't matter. Like it's just going to keep reoccurring. So like it's the same thing with like everything you talk about, like fitness and the psychological aspect behind that. Like we always need to get down to like that basic bare bones roots, because otherwise you're just building everything on top of cracky foundation, and like nothing's actually going to last long as a result of that. Like it's
Dude.
even this thing we see with like ACL patients, and like even think about your favorite like NFL athletes or NBA athletes that maybe sustain an ACL injury. It's like the same thing. We see greater ACL re-tear rates with those that do not have an optimistic outlook on their confidence coming back to the field playing the sport versus those that do. And it's like a very clear difference.
Interesting. So I'm curious because I want to kind of understand that a little bit more. Like, why does that psychological outlook have such why is that such a big indicator? Like, where's the psychology like saying? Like, is it just because if they're less optimistic, they're less likely to stick with the regiment? Really?
It's really a combination of things. So it's from the same, so all of this basically stems from something called like pain neuroscience education, and essentially it's a couple things. That is part of it, right? I think part, like for example, the ACL example I just gave, like part of it is the if you have a lack of confidence in returning to the field from your injury or pain, then you're more likely to be overly cautious in certain scenarios and potentially get into certain situations that aren't the best. There is that actual little side to it, but then there's also the side of like essentially you can think of it as, like I said, like all pain is an output from the brain, meaning that, you know, your brain is constantly sending signals and feedback through afferent and efferent neurons, dictating whether or not you should feel something or not, right? And that's important because understanding that and understanding that everything starts from the output of the brain and the meaning that it chooses to assign something, the psychological component is important, because if you have essentially the wrong meaning that you're assigning to something, or quote unquote wrong meaning you're assigning to something, then it's essentially going to send feedback or signal through those afferent and efferent pathways to the muscles and to the nerves and fibers, being like, hey, something's wrong, we need to protect you and like guard up, essentially, right? That's why even things like, for example, tight muscles, like everyone's like, I need to stretch all the time, and it's like, yes, but no, because a lot of times, like tight muscles also are protective mechanisms that the brain puts an output towards, of like, I need to guard this area. So let me just restrict your range of motion and tighten up chronically so I can protect and guard this from any danger that comes about. So that's why the psychological component matters. And that's why it's so important, because literally everything stems from the brain through those afferent, efferent pathways to begin with. And if you don't start there, like your brain's going to prescribe whatever meaning it wants to choose to assign to it. And if you're not conscious of that, it's going to assign the not so right meaning that you want it to have. And as a result, you're just going to continuously be in this chronic pain cycle over and over again, being pessimistic, wondering like why nothing's ever changing, right?
Yeah.
So it's the same thing with like, I mean, it's the same parallels we draw with like assigning meaning to things we tell ourselves, or fitness, or like how we view exercise or food or any of that. Like it's the same thing.
It all stems from the same area, right? And that's why I love fitness and health journeys in general, because you learn so much about yourself, and you get to, like, I'm hearing you talk and I'm just like, holy crap. It's like it's all fucking connected, man. It's just
Yeah.
so cool because it's still, you know, most of the time, we as individuals, you know, we know what we should be doing, right?
Right.
And however, our cycle, or the way we view things, the way we perceive things, is what really gets in the way. I would say 90-95% of the time, not because we lack the knowledge, but we get in our way. I like to imagine it as the meme where the guy's like riding a bike and he pulls out a stick and just shoves it in his
Yeah.
own spoke.
Yeah.
But you know, because we don't realize that the psychological aspect isn't just us being assholes. There's a biological reason for it. There's a protective response to a lot of these things that we just lack the awareness and understanding, right? And
Yeah.
getting to that root can be very difficult to identify and really pull out, you know, when it comes to weight loss. But you know, it's even this, as I'm learning right now, you know, it's super funny. I'm going to go on a tangent real quick, but your framework is very similar to mine. I actually called mine the reps framework as well,
Nice.
which is the R stands for rewire. Well, I kind of changed it: rewire, rebuild, and then refeed. So it's a 3R. and
Mhm.
then execute, and then permanence, right?
Right. Yeah.
Same kind of same philosophy, right? They're
Yeah.
all
Mhm.
core built in the same thing. It has to start up here, right? Because
Yeah.
if we don't address the way your brain is firing, the way you see these
Mhm.
things, you're
Mhm.
ultimately going to put yourself unintentionally in a place that's going to, come into a risk of re-injury, or,
Yeah.
put you in a place where you don't want to be unintentionally, right?
Yeah.
So
Yeah.
I'm curious to know, because I've had a couple clients that have come with, pretty severe injuries, bulging discs, so, and pain so bad that, it's very difficult for them to even get to a level of
Right.
somewhat thinking about doing an exercise that they used to do
Yeah.
that could possibly re-injure. They have to go back and get surgery again, right?
Mhm.
So if you have someone like that who has those pretty severe, uh, plates and discs improved or added into their body, do you
Mhm.
still go the same philosophy, or are you more like, okay, let's work around that? But
Mhm.
where's your take on that? I'm
Yeah,
curious.
it's the same philosophy, just different starting points, right?
Yeah.
I always like to say like all rehab and all like fitness and training are one and the same. It's just different starting points, and fitness and training is a higher starting point. Rehab for athletes might be a higher starting point. Rehab for the population you're talking about, or people that come with like those specific injuries, is a lower starting point. But it's the same general framework. It's like we have to first desensitize pain and improve their mentality towards it, and then progressively increase the exposure like over time. It's just a much lower starting point. So for people like that, a lot of times, like when I've worked with people in that position, many times it's like very simple, like low level, core isometrics, table exercises, think your traditional physical therapy stuff that like people normally think of. It's like that sort of thing, because that's just where they're at starting point wise. And a lot of times, like to help desensitize some of their pain and start to rebuild for low back patients like that, like their core strength and etc. and TVA strength to eventually get back to all those other activities, that their starting point has to literally be tabletop exercises, isometric exercises, like very low level type drills that eventually start to build up towards being able to do more functional activities, that then eventually builds into doing more gait related activities that they're maybe used to or wanting to get back to doing, right? So it's the same process. It's just a much different starting point for those individuals versus maybe your more athletically minded population, or people that don't have an injury and they're just like trying to like stay resilient from sustaining said injury, right?
Yeah.
So that's really all it is. It's the same process at the end of the day.
It's so cool, because I dabble, I'm always trying to study and understand these things, because the more I know, the more I don't know, and it really
Yeah.
pisses me off, right? um and to get to that level of understanding corrective exercise, as a former athlete, I hated corrective exercise. It was boring. I
Mhm.
still don't really like it all that much. I'm dealing with a stress fracture that I continue to re-injure because I because I'm just I have I have this strength and this weakness where I'm really good at dealing with pain, but
Mhm.
it doesn't it's what hinders me in the long run, because I don't necessarily take the rehab, the small stuff very, very seriously. But in reality, it's the small stuff that matters the most,
Yeah.
especially when you're looking at it from a holistic point of view,
Mhm.
right? So many times we're just like, how do I immediately relieve the pain? How do I immediately get out of this discomfort? When I now I'm going to go down another rabbit hole, but I'm also in jujitsu, and I think this is a very perfect example. Have you ever done any martial arts or anything like that?
I've literally been in martial arts since I was like 4 years old. Like
Really? Oh, that's so cool.
yeah, I started on like karate, picked up like Muay Thai when I was in my teens, picked up jujitsu at the same time. Like I've been doing it my whole life.
Oh, badass. Okay, so you're gonna know exactly what I mean when I say
Yeah.
when in jujitsu, it's a very uncomfortable position, like almost all the time. It when
Mhm.
especially when you're like me, who's basically a baby giraffe, baby white belt trying to figure his
Yeah.
shit out. You know,
Mhm.
I get in very stressful, uncomfortable situations, and my first go to is I need to get out of this situation now.
Yeah.
That's it. I don't care about what else, anything else, but getting out of the situation. So because I'm in that immediate pain and discomfort, I want to make the split decision to end the discomfort now, not realizing that it may put me in an easier position for my opponent to end the
Mhm.
match and put me in an even more uncomfortable position. right?
Mm-hmm.
And then
Mm-hmm.
I'm asleep on the mat because I didn't like them laying on me this wrong way, because and then I'm just trying to get out of it, right? So this same kind of philosophy, and that's why I'm going to keep going back to jujitsu, because it's just so applicable in so many other areas. But like that same philosophy that we have in our head, like I got to get this over with, I got to get this over with, I got to get this over with, right? Like now we don't realize, we don't look a little bit further ahead. We don't look at what at the possible risks, right? It's the whole go back to when you're a kid, think before you act,
Yeah.
right? Well, we forget a lot of the old adages as we get older, because we're adults. We should know
Right.
how to take care of ourselves, but we don't.
Right. Right.
We get so disconnected with all this stuff, right? So, when I'm curious to know, like, I'm sure you've had this aspect of your job, right? It's every coach has to deal with like that really really tough client that's just not it's not connecting.
Mm-hmm.
Like the roots aren't really connecting with them, and they're still so stuck on the end of the journey, right? The for you specifically, getting out of discomfort,
Yeah.
right? So how do you manage when someone is so focused on the outcome? How do you remind them to focus on the little stuff that we're talking about, the psychological aspect, that are
Mm-hmm.
really building a much more solid foundation?
Yeah. It's a couple things. I think I, first of all, like, try as best I can to get patients and clients like focused on just other goals that aren't tied to like the end outcome of like pain free. Like I always tell, it's funny, like anytime I'm doing an evaluation, or like within our coaching company, anytime like one of our like other coaches is like doing like an evaluation with a patient, like I always tell them, and I do this myself, it's like, like even if a patient tells you that like their goals, like when you ask them like what are your main goals, like what do you want to get out of this, and they're like I want to get pain free, it's like great, what else? Like, because if we only keep on that goal, it's like that doesn't do us any good. So I'm always like, what other goals can we focus on during this process, like other than getting pain free? Because a lot of times, as I always like to tell patients as well, pain isn't always tied to function, meaning did we really not make progress if 12 weeks down the line someone who wasn't able to do any barbell squats, lunges, or deadlifts without pain now is able to do them, but they might have some slight discomfort? They're not pain free, but 12 weeks ago, they weren't able to do any of that stuff to even begin with, let alone get out of the chair like without having pain, right? So it's like, if they don't reframe that perspective in the first place, or we get them to rather with the process, then they're just looking at the shiny outcome of I'm not pain free, I guess I didn't make any progress, where it's like, no, like you made a boatload of progress. So, and that again feeds into the mentality, which then helps how you see things, which then reinforces you actually being able to stay pain free long term. So that's number one, is like really just like reframing their perspectives on like, okay, what is like the actual goal here that's not tied to just I want to reduce my pain level and get pain free. Cool. Like what else? What are some actual functional outcomes that we can tie this to actually look at which gets more process oriented now, so that we can just continuously improve and look at the process day to day or week to week versus the shiny outcome that we're after, right? I think that's number one. And then number two, it's like reminding them of the overall big picture at all times of like why we're doing what we're doing, and like why every single thing has a purpose to what we're doing. And I always make sure to just emphasize that point every single time I'm telling patient to do something, or like explaining why I'm doing something. It's like, hey, like, we're doing this because, like, psychological stuff aside, it's like, hey, like doing this is going, and a lot of times I don't even mention the psychological stuff for them. Like it actually just gets fed into like what I do, because I'm a big proponent of like meeting someone where they're at. And
Mm-hmm.
with some people, I can have this whole in-depth conversation around the psychology of pain, and they love that stuff. But like with other people, I'm like, I know I'd be running them away if I did that. So I meet them where they're at. And a lot of times, all this stuff I'm telling you just gets fed into what I'm doing. Like, some people will argue like a lot of the corrective exercise, like we'll do or other trainers will do. Sometimes, a lot of times, like that stuff doesn't work just because of the only like physical biomechanics of it. Like, yeah, sure, it does. But like a lot of times that corrective exercise and stuff, like I'll give patients some things not because of like what I think it's going to do for them physically, because I know them doing it is going to reinforce confidence for them indirectly to then be able to more effectively perform higher level movements and be pain free long term, right? So like I also give people and patients exercises like that on that perspective rather than the former. But really it's just educating them on why we're doing what we're doing. It's like, hey, like I know you don't want to be doing this right now, but like this is why it's important, because we need to blah 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 blah, right? All the nuanced reasons that we're talking about why someone needs to increase their pain or their tissue tolerance and capacity to be able to handle more later on, all that stuff, right? So I think it's like those two things. It's like actually getting them to understand the why, but then also reframing their perspective to be more in the process versus the actual big picture outcome, and not making the only goal being pain free. Just like with fat loss clients, it's like your only goal should probably not be, I need to lose these 50 pounds and fit into this dress. It should probably be other things aside from that, right?
Yeah, exactly. It should be. I was just talking to one of my clients who's been with me for a while, and when she first started, her whole entire focus was losing weight to fit into, or to I think it was like lose 20 pounds for her high school reunion.
Mm-hmm.
Um, and as we kept going, as we were identifying, there was a lot of behavioral dysfunction, a lot of all or nothing mindset that came into this, where she's like, I'm either in or I'm out. And it's
Yeah.
like there's no in between. I was like, okay, well, I'm glad that you have this goal. We're gonna do our best to get you there. But if we don't understand this relationship you have with yourself, you're going to have a really, really hard time even getting to that point of sustainably losing weight for your high school reunion, right? So
Mm-hmm.
we took the focus away from the reunion and focused on everything that she was lacking right now. She loved to run. She also loved to lift weight. She was a competitive athlete. When she was back in high school, she's in her 50s, right? She hasn't had that same level of athleticism, and she wanted to
Yeah.
get some semblance of that back, right? I was like,
Yeah.
awesome. That's something we can focus on right now, as opposed to focusing on how much weight we can lose in 6 months, right?
Right.
And
Yeah.
as we were focusing on that, as we were paying attention to those things, she came out just like the other week, like, I have never been this consistent outside of sports.
Mm-hmm.
And it was almost 30 years since the last
Yeah.
time she's been this consistent with herself,
Yeah.
right?
Yeah.
She started feeling way stronger, right? She's getting in and out of her shower with no pain, no like confidence,
Yeah.
right? She wasn't losing weight, but she was feeling better.
Mm-hmm.
And then she started falling in love more with that than the actual outcome. So that when the high school reunion showed up, she walked in there and said, "You know what? I could probably bench more than most of the people in here, even
Yeah.
though I'm not losing weight." She still had fat loss responses. Her clothes were fitting better. Her husband was seeing changes, right? And
Yeah.
she felt better overall. And now she's nowhere near where she was, because we pulled it away from the outcome, right? And
Mm-hmm.
I like to think of it like this: like, when you're driving on a fucking highway and you're not looking 20 cars ahead, you're looking at the one that's right in front of you, right?
Yeah.
If you're looking at the car that's 20 cars ahead, you're probably not going to get to your destination. You're probably going to run into every car and obstacle on the way to get there. So when we dial it back and slow down and look at what's right in front of us right now, understand the why behind it, right? Because you know we're stubborn as humans,
Mm-hmm.
especially if
Very.
you're like me and you have a superiority or authority of problem with authority. There it is. You just tell me to do something without really explaining why. I'm gonna be pissed about it, right? But if
Yeah.
you can help me understand it, I can buy into it, right?
Yeah.
And that's
Yeah.
I love that philosophy as well, especially when it comes to moving pain free, right? Get away from the outcome and focus on everything that you're gaining right
Mm-hmm.
now. Because
Mm-hmm.
focusing on that, going back to the psychological aspect, it's the same for a weight loss journey. No matter what, your brain will get what it's looking for. And if
Yep.
it's always constantly reminded of all the bad or the lack that you are experiencing, instead of focusing on all the changes that are happening, you're going to continue to find reasons to get back to where you are, to feel stuck,
Yeah.
to feel
Mm-hmm.
frustrated, right?
Mm-hmm.
God, this is so awesome, man. So I love this. I love this. So I'm really curious to know if I want someone who's listening to this, right? We're talking a lot about the broad side of these things,
Yeah.
but ultimately, when I reached out to you, I was like, hey, this is my scenario of a client I'm struggling with, but I know you're to get like a much more in detail response, you're probably going to have to do an assessment. So, for the general person who, may not have the time or is just curious at how to get started, especially if they're struggling with chronic pain,
Mm-hmm.
what are the easiest steps someone can start taking right now that could help, lower back pain, knee pain, shoulder pain, anything that you feel like is most common? Like, what are
Yeah.
the easiest steps someone could take right now to help improve and reduce pain that they may be dealing with?
Yeah. I think obviously there's the blanket answer of go see your professional, right? But I'm actually going to give you some subs here. But really it's like number one, do a movement assessment. So like just like any professional would, or like I would if I was working with someone, the first thing I always do is like a movement assessment, right? We have to actually identify what's hurting, when it's hurting, where it's hurting, what movements it's hurting during, all that stuff. You can actually do one yourself depending on what joint you're dealing with that's like actually causing you pain. And you can, for example, if we're taking the low back again, it's like you can do a simple movement assessment yourself and, lean to extension all the way back, lean to flexion all the way forward, rotate your spine either side bend either way, and just look at where am I feeling pain, what motions am I feeling pain with? What would I rate that on a scale of like 0 to 10? And just like ask yourself these questions as you're moving through those ranges of motion. Same thing goes for if you're dealing with like knee pain. It's like, okay, when I bend my knee and extend my knee, like where am I feeling more pain at? Is it with extension or is it with flexion or bending? If I'm doing a squat, when am I feeling the pain? If I'm doing a lunge, when am I feeling the pain during what range of motion? Same thing with the shoulder. Move it during all planes of motion, flexion, extension, rotation, etc., and identify and ask yourself, when am I feeling that pain? Because you can't actually narrow down on like what you actually need to do if you don't know where it's stemming from in the first place, right? So number one is that movement assessment, right? Number two, off of that movement assessment, once you identify, okay, I'm feeling pain in my back when I bend backwards and somewhat when I twist, but if I, flex my spine, I'm fine. Or maybe vice versa, it's the other way. And it's like for most people, hey, if I extend my spine or twist, like I'm fine for the most part. But if I bend over, like to tie my shoe, I get like excruciating pain. Like that's where I feel it. It's like, okay, cool. That leads to like the next step of the whole concept of like the reps method of what I talked about in the beginning is essentially it boils down to with pain. I'm going to blanket statement this, although it's not a blanket statement, which is the majority of pain is caused when majority of injuries are caused when load or when the applied load on a tissue exceeds the tissue's capacity or tolerance to withstand it. So when applied load is greater than tissue tolerance. And what I mean by that is when you do, like most injuries are caused by doing too much too soon after too little for too long, meaning a lot of times it's not necessarily like the thing you did that like got you hurt. It's usually a whole bunch of little stuff that built up to it and your body was just not yet prepared to handle those ranges of motion, those loads, that volume, whatever that may be, the amount you've done, and you get pain. Like I'll see a lot of runners, for example, and they'll be like, my knee's in so much pain. The first question I always go to is like, what has your training look like? Let me see your like mileage logs. Like, what does this look like? And like, if the first thing I see is that I had this massive spike in volume where I went from running 10 miles a week to like 30 to 40 miles in a week, and like now my knees hurting all of a sudden, it's like, okay, the first thing we gotta do is just strip some stuff back because like that's where a lot of it's coming from in the first place, and it's easy low hanging fruit. So for you listening to this, it's looking at number one, if it's training related pain, like you're in the gym or something like that, look at what has your program looked like. Hopefully you're with a coach. If not, that's step number one. But number two is identifying, what am I doing? Like maybe did I do something recently that maybe it was like too much that I wasn't used to doing? Like did I walk way more steps than like I was used to do? Like in fitness, a lot of people get caught in the trap of being like, I need to hit my 10K step goal. But like if you're coming from being sedentary and getting like 3,000 steps a day, and all of a sudden you're like, I'm going to get 10K steps. And then now you're like complaining about plantar fasciitis or foot pain. It's like, hey, like, let's look at that first, So identify in your programming, like if you're doing too much in certain areas. Otherwise, when I was explaining that concept, it all boils down to really, other than the low hanging fruit there, looking at in that second step after you've done your movement assessment, based on that, you can then select exercises or mobility drills or strengthening drills to work on those specific areas that you identified you feel the most pain in, and slowly start to expose yourself from there. Again, like going back to the original conversation, we have to start doing and entering into and poking the bear, if you will, with the movements that got us hurt in the first place, within reason, obviously, and within reason of what we're actually capable of tolerating that certain standpoint. Also understanding that beyond the psychological, when it comes to the physical, again, a lot of injuries occur when load exceeds tissue capacity. So we need to actually build up your tolerance in those positions to physically be able to be more resilient and handle more. So once you identify what those positions are, you can start to look at different exercises to work on those specific positions in question and actually improve your strength tolerance within those ranges of motion. Because it's also going to benefit you psychologically, and then physically it's going to benefit you from all the reasons I just mentioned. So if we're taking the same example and it's like, back pain when you bend over to like tie your shoes or something like that. It's like, cool. Let's going back to the reps method, do something that calms down that pain, which can look like different mobility drills and stretching drills, like within that same position to help desensitize some of that, plus exploring all the other positions of your spine that you don't get that pain with. So you can start exposing your body to a variety of ranges of motion. And then two, once you've restored that pain, now working on exposing it to those movements where if it's flexion, for example, where you're bending over to tie your shoes and that's where you're getting pain, doing different exercises that low level wise expose you to those demands. That could literally be for some people as simple as repeated flexion of bending over and standing back up and basically just doing that body weight if they're in a lot of pain and like that's all they can tolerate. Great. That's the starting point. For some other people, it might be like a modified light kettlebell deadlift, like off of a step that's like super reduced range of motion. Okay, cool. We're exposing yourself to that flexion range of motion. You're not getting too much pain with that, maybe just like discomfort, which is okay. Great. That's your starting point. And then the whole goal is to then gradually expose yourself to greater and greater demands over time to eventually get to the end goal of the movement that hurts you in question and where you're trying to get back to. It's the same thing with like fitness training. Like if you want to get a stronger bench or stronger squat, what do you have to do? You probably need to bench more, squat more, do all these other exercises and actually progressively overload week after week and increase your strength, right? It's the same thing with rehab. Rehab requires progressive overload the same way as getting stronger and fitter requires progressive overload. So you need to actually start exposing your body to those demands over time to actually build up that resilience. And that comes from what we call in the rehab world of graded exposure, which is just our way of saying progressive overload, essentially. So you just go through that process over time gradually. You increase the range of motion of the exercises, you increase the weight and difficulty of the exercises, you increase the frequency, the volume, etc. over time to eventually get to the end destination of where you want to get to. And that will essentially lead you, super broad scope, but still tactical, down the path of getting to eventually having as little pain as possible with those functional activities in question, right? And then there's like a whole other side of like, how do you actually stay pain-free to begin with? But that's essentially like that crux of the model.
Dude, I love it. I love it so much, especially the amount that you just gave. It sounds like a lot, but it's necessary, right? Because there's levels to this. You have to understand where you fit in this certain situation. There's no magic bullet no matter what you want to do, right? And so many people that struggle with chronic pain are always in a place where they put themselves in they don't put themselves in places where they can cause re-injury, and it makes it harder for them to be active, to live the active lifestyle that they probably enjoy, that may be hampering their overall health goals in general, so that if that's something you truly want to change, you have to understand the full aspects of it. You have to understand that, become aware of where the pain is coming from. Or if you're really serious, go hire somebody, right? Ultimately, we're stubborn. We're so stubborn when it comes to ourselves, right? Like, and I trust me, like I'm still stubborn when it comes to my own personal health, right? It's like I should figure it out. It's my body. I'll be fine. But really, if you want the full effect, go hire Dr. Kev. Seriously. But
we'll take care of you. Come over.
Yeah. But if that's a level where you still want to do your best to figure it out on your own, it's not going to be a silver bullet. Nothing is silver bullet. Awareness is key first. Identify where the pain is coming from, right? See when and where it happens, so that then we can identify, okay, what was the history? Where is this coming from? And then progress you through a level of very, moderate, very low impact ways to put the put the stress back on your body, but improve the load bearing so that you don't ultimately, after we identify it, we feel better, we feel more stable, and we're less risk of re-injury over time. But it's not a silver quick fix, just like do these things, right? There's certain things that we can do to prevent it, but ultimately, if you're not aware of where it's coming from, it's the same thing as just fucking cut your carbs and move more. Right?
Exactly. Okay, cool. How does that actually help? Right?
Yeah, it doesn't help. It's just stop eating. Oh, cool. Thanks, boss. I appreciate that. So, Kevin, this is absolutely awesome. I know you got to get out of here soon. So, I wish I was taking notes, but luckily I recorded this. So, I mean, I'm going to be able to come back to it anytime. Where can more people find you, man?
Yeah. So if you want to connect with me, easiest place to do so is Instagram. I'm active on there all the time. You can find me at my handle, which will be in the show notes, but it's just Doc Kev Fit. If you have any questions about anything I just talked about on this podcast, or like have a question about an injury you're dealing with or anything like that, feel free to just shoot me a message on there. I always love like going through my DMs and answering questions I get. So feel free to shoot them over. Easiest place to connect with me. If you're more of a Facebook person, you can also find me there. It's just my name, Kevin Hamidi. But otherwise, Instagram is the best place.
Awesome. I appreciate you, boss. Thank you so much for coming in. Thanks
Or
for
Steve.
dropping all those knowledge bombs. I learned a lot. And I'm gonna make sure my clients listen to this one. And yeah, man, I appreciate it. So you have a great rest of your day, and we'll see you soon.
Appreciate it. Thanks, Jonah.